Hi, everyone. Thank you for joining us for today's webinar, Treating TMJ Using a Multifaceted Approach. My name is Robin Pierce, and I'm the Senior Brand Manager at L.AC. TMJ disorders can cause significant pain, tension, and dysfunction in the jaw, neck, and surrounding muscles. In this one-hour webinar, Michelle Gellis will present a comprehensive approach to treating TMJ. Our webinar presenter, Michelle Gellis, is a Florida licensed acupuncturist and founder of AcuLift. She's currently on faculty at Yosan University and was the former faculty and clinic supervisor at the Maryland University of Integrative Health. She teaches facial acupuncture internationally and has been published in prominent acupuncture publications such as the Journal of Chinese Medicine. Throughout her career, Michelle has been sought out to lecture by numerous prestigious national and international organizations, such as the Florida State Oriental Medical Association, the Acupuncture Association of Chartered Physiotherapists, China Books, and American Acupuncture Council. Before we get to the presentation, let's just take a moment to acclimate to the webinar room. To the right of the screen, you'll see two tabs, Questions and Chat. To connect with other attendees or notify us of any difficulties, please use the Chat tab. At the end of the presentation, we'll use the Chat tab to post a promo code specific to this event. If you have any questions for Michelle, please use the Questions tab. Your questions will be answered at the end of the lecture during our Q&A session. Please note that each webinar is recorded, and immediately following the conclusion, you'll receive a link to view the video on demand, a copy of the slides, and a promo code to use on your next order at LASA-LMS. So without further ado, I'll pass it over to Michelle.
Thank you, Robin, and welcome everyone. I'm really excited about being able to present this short 45-minute course on treating TMJ using facial motor points, scalp acupuncture, and submuscular needling. So the one thing that wasn't in my bio is my book, Treating the Face, was released in November of 2024, and it is a hardcover book, and it's over 500 pages, and full color book, and it covers every aspect of treating this face, both neuromuscular, cosmetic, the spiritual aspects of treating the face, and all different types of safety, ethics concerned with treating the face. So today, the information I'm going to be providing comes from chapters 6, 7, 8, 9, 10, and 11 of the face. So let's hop in. So I'm going to go through the etiology of TMJ and the symptoms, the theory behind using a multifaceted approach, facial motor points, scalp acupuncture, submuscular needling, facial cupping, and I think I even have a little bit about derma rolling. So what is TMJ? TMJ is any disorder that is resultant from any kind of disharmony that results from problems of the jaw joint, and the surrounding facial muscles that are involved with chewing and moving the joint. And TMJ stands for Temporomandibular joint. And what it is this hinge right here between the jaw and the temporal bone of the skull. The etiology can come from a lot of different things can cause TMJ: grinding or clenching the teeth, an injury, some sort of a dislocation, arthritis, stress, which can cause us to grind our teeth or tighten the jaw area, and or any sort of injury to the muscles of the face, head, and neck, which can cause tension in the area, resulting in pain. So what are some of the symptoms? Some of the symptoms can range from pain behind the eyes, sensitive to light, bloodshot eyes, any issues with opening the mouth, even closing the mouth, discomfort, clenching your jaw or grinding your teeth. Your teeth can be sore, and the jaw area itself can be sore. We can get pain in the cheek. We can get clicking and popping of the jaw when we open and close it. And the jaw can also deviate to one side. We can get headaches because of the connection between the jaw and the temporalis. You can get headaches, and this can radiate down to the back of the neck. Your scalp can get sensitive. You can have issues with your ears because of the location of the joint. You can have vertigo, dizziness, hearing issues, ear pain, ringing in the ears, and also neck pain, shoulder pain, and this can result in numbness or tingling in the arms or the fingers. So what exactly is a multifaceted approach, and why would we want to use it? Well, when I first started teaching and practicing cosmetic acupuncture, kind of the word got out through my advertising in my practice that I worked on the face. And what ended up happening as a result was people were coming to me not just for cosmetic concerns, but they were also coming to me for Bell's palsy and trigeminal neuralgia and TMJ. And what I found over the years was that in order to treat some of these really stubborn, hard to treat neuromuscular facial conditions, using a multifaceted approach, so using a couple of different techniques combined together, would give the fastest, deepest healing and longest lasting results. So first I'm going to talk briefly about motor points, and this is not by any means a comprehensive training in any one of these modalities. My goal is to familiarize yourself with them, give you an example, and then if you're interested, you can deepen your study in how to use these particular techniques and protocols to treat different neuromuscular facial conditions. So that said, motor points, what a motor point is the place where it is the most electrically excitable part of the muscle where the motor nerve bundle goes into the muscle. And motor points are not trigger points. Trigger points are like our A.C points, right? You press on them and it's usually tender and you put the needle there. Motor points aren't necessarily sore spots in the muscle, so they're two different things. So here's a peripheral nerve, and this is a sensory nerve which goes out to the skin, and this is a motor nerve which goes to the muscle, so this would be the motor point. I got this from an old medical textbook. This is based on Western medicine, all of the different motor points on the face and neck. And I became completely fascinated by this, mainly because so many of these are acupuncture points. So the good news about facial motor points is many of them are acupuncture points that we are already familiar with. Not all of them, but many of them. So it makes it easy, if you know where the acupuncture point is, it makes it easy to find the motor point. When you're trying to figure out which motor point you are going to use for any specific condition on the face, first you have to determine which muscle is affected. And as we know, there are a lot of muscles on the face, and there are 18 motor points on the face alone. And as I mentioned, some are acupuncture points. So here's a list of all of the muscles that have motor points on the face, and head and neck. But when we're thinking about TMJ, we're only going to focus on a couple of those. So the technique that I use whenever I needle the face, I put a little arnica gel to help prevent bruising, and then I use a 0.16 millimeter gauge needle. You put it into the belly of the muscle, not through the muscle, and you're going to kind of lift it and push it back in and out gently, and twist it a little bit until the muscle jumps. If it's performed incorrectly, it can result in damage to the nerve. So you want to make sure you don't just go off and try this on your own. You want to make sure you receive proper training, and you want to make sure that your patient is appropriately screened for any sort of contraindications. So the needles that I use on the face on most of my neuromuscular facial patients are going to be the red Sarin J-type needles, the 0.16 to 30 millimeter, so I call them 1-inch needles, or the 0.16, the 15 millimeter, which are like the half-inch needles. It just depends on how deeply I'm needling. If someone's skin is thinner, like they're older or they're just more sensitive, you can use the light green needles, which are 0.14, and these will work just as well. So the first motor point I want to talk about is the one on the temporalis. So this is an image from my book, and here's gallbladder 8. And then directly anterior to gallbladder 8, one soon anterior, is the motor point. And you would do a perpendicular insertion. And this is a great motor point for people that get temporal headaches and for people that have TMJ, because the temporalis and the masseter are connected to one another. The next motor points would be the motor points for the masseter itself. So the masseter is deep to the rosaris muscle and to the depressor anguli oris and a couple of the levator muscles. So the best way to find the motor points for the masseter, it has two motor points. So one is between stomach 7, it is just slightly inferior to stomach 7, and it is level with the earlobe. I don't like to use that definition too often because as we get older, our ears get bigger and bigger, and depending on the person's anatomy, their earlobe may be much lower than that. So I just go with slightly inferior to stomach 7. And the other one is actually, as I mentioned, some of the motor points are acupuncture points. So stomach 6 is the other motor point for the masseter. This is not the masseter, but I just wanted to show you an example of what it looks like when you needle a motor point. So this was a student of mine in one of my cosmetic classes, and she had had Bell's palsy. Let me see if I can pause this. She had had Bell's palsy many years previous, and she still could not purse her lips and had trouble drinking through a straw. A few different disharmonies that I recognized had to do with the mentalis, which is right here. So I needled the motor point for the mentalis, and you could see as soon as I put the needle in, it started to vibrate. And then once I stimulated the muscle, the needle, I'm sorry, the muscle really jumped. And she reported the next day in class that the issues that she had been happening, that she had gone away. And we kept in touch, and she said that she had needled herself in that place a couple of times and had no reoccurrence of the problem with that muscle. Let's see if I can get to the next slide. Okay, so brief overview of scalp acupuncture. Scalp acupuncture is a very modern, in terms of Chinese medicine, a very modern acupuncture technique. Really became popularized in the 1970s. And scalp acupuncture does not use acupuncture points. We use different areas of the scalp are stimulated with or needles over areas of the brain that correspond to the area that we're treating. So it's based on neuroanatomy, not acupuncture meridians, which makes it really great and wonderfully suited for cosmetic and neuromuscular facial conditions. So these can be motor conditions, and these can be sensory conditions, or both. So the areas that, when we're thinking about the face, there is the motor area on the scalp, which is used for facial paralysis, weakness caused by stroke, MS, Bell's palsy, brain injury, a multitude of other motor dysfunctions, or sensory conditions like TMJ, trigeminal neuralgia, where there's pain. And as I mentioned, it's based on neuroanatomy and also the homunculus. So for the motor area, the area for the face, this is a cross-section of the brain. So this is motor, and this is sensory. And you can see on this picture here, the motor's in front and the sensory is right behind it. But in both images, you can see what a large area the face takes up on the brain. What you do is you are going to insert a needle, not perpendicularly, but horizontally into the loose connective tissue. So we have the skin, the close connective tissue, the aponeurosis, the loose connective tissue, and then the pericranium, which is bone. So the nice thing is when you're trying to get down to the right level to insert that needle, you really can't go too deep because you'd be going through the bone. The needles that I like to use, I use slightly heavier gauge needles. I use the J-type, light blue, either 0.20, usually 0.20, and then I'll use 30 millimeters, so the longer needles. So here's an image of how you would measure the head in order to find the right area. So here's the face area for motor. So you measure from the glabella to the occipital protuberance, and from the glabella to the occipital protuberance, and from the midpoint of the eyebrow back again to the occipital protuberance, and where these two meet, this is kind of where you're going to be thinking you need to be. And you just go back a half a centimeter, and this is the motor line, and right behind it is the sensory line. But we're just going to talk about the motor line for right now. And you're going to break this into fifths. The bottom 2/5 is the face, middle 2/5 that we're not concerned about for the purposes of this class, upper extremities, and the top 1/5 is lower extremities. So we would be needling right here, and the needle would go along the scalp, not perpendicular. So here is a video that I made.
So once you've found your angle,
how to needle,
you know where your line.
so you get the, what happened?
You
get the right angle, the correct angle.
Area that's used to affect the face is, again, as I said in the lecture, it is the bottom 2/5. So you're going to be needling the bottom 2/5. Now this tends to be a little sensitive area because there's muscle here. When you're needling, you have to make certain that you're going to the correct depth, and you want to make certain that you do it very quickly. You don't want to tentatively needle this. This is something that has to be done quickly. I always use tubes. It's entirely up to you, but I would strongly recommend this.
So I tap the needle in, and you can see here my finger is on, well, it's on her hair, but it's on the scalp. And when I push that needle in I'm left-handed, so I'm pushing the needle in with my left hand, and then I'm using the thumb of my right hand to push it all the way down. If you get down to that loose connective tissue, your patient should not feel any pain. If you are superficial to that, there's a lot of nerve endings, and it can be painful. But the trick is, once you get the tip of the needle inserted, work quickly, just push the needle down. You really, if you're going deep enough, you shouldn't reach any resistance. And then once it's in, you stimulate the needle for 30 seconds, either with electricity or with your hands, and you have to do that about every 10 minutes.
Tap it in. Every patient, take a deep breath, and you insert all the way up to the handle. Okay, so that's for the this needle that I just put in would be for the motor area, and then again the sensory line needle would be right behind it. When you take the needle out, you always make sure you use pressure and massage the area. Now this tends to be a little
I don't think I
sensitive.
can
You
get
want
to
to make
the next
certain.
slide here. Thank you. Okay. The next technique that I use is submuscular needling, and I absolutely love this for stubborn conditions, cosmetic things, and in fact, I have some submuscular points that I use that are mandatory in my protocol for cosmetic. But essentially what submuscular needling is great for is any atrophied or overly tense muscle, and it's particularly good for long-term facial paralysis. And here are some of the muscles on the face and neck and the head that you can use when you are doing submuscular needling. So the ones that we're going to talk about for TMJ would be the masseter, the temporalis, and I left out the auricular muscles. Those are 3 muscles that are around the ear, and those are very, very beneficial also for submuscular needling. So the needles I like to use are the red serins or the light green serins if someone is more sensitive, has thinner, older, more delicate skin. So here's the temporalis right here, and here's the masseter, and these arrows indicate where you would put needles around the outside of the temporalis and or underneath the masseter. And then there's a group of 3 muscles, the auricular muscles, and you could also needle under those. And the goal is to get underneath the muscle, and this can help with any fascial adhesions. It helps to bring blood and chi and energy to the area. And if the person has tension in their jaw, they can feel it release almost immediately. So here's the masseter, and you would take needles and you would put 2 or 3 needles right underneath this masseter muscle. In some instances, the masseters are pretty deep, thick muscle. You might be going through it, but the goal with submuscular needling is to get underneath that muscle. And here is a video demo of me doing that.
Is the masseter, and the way you isolate the masseter. Will you turn your head to the side, please? You have your patient bite down. And again, just like with the frontalis, with the masseter, you go from the origin to the insertion. And I like to needle towards myself whenever I can. Again, I don't touch the needle. I'm just using the using my thumb to guide the needle to the correct depth. You just get it right in under the muscle, just like that. And you go from the origin to the insertion and right underneath the muscle.
And a lot of times if your patient has TMJ, you see how her masseter is just bulging. This is one of the things when I'm doing cosmetic acupuncture, I will notice on my patients, and I'll ask them, I'll say, does your jaw click and pop? Do you have pain? And they'll say, yeah, how did you know? So you can feel it. And this is wonderful for that.
Just like that. And there you go. Is the
Okay. So the next technique that I use for treating TMJ, and this is a patient favorite, so I wouldn't skip this step because there's no pain involved. And this is facial cupping and facial gua sha. So a lot of people think of this as more of a superficial, skin rejuvenating technique, but if facial cupping and gua sha are done properly, they can affect incredible results just on their own and not cause any marks on the face. So some of the theory behind this is the facial nerve, which controls the motor movements of the face, exits to the surface at Sanjiao 17. And then it bifurcates into 5 branches across the face. And facial cupping and gua sha can help to release nerves which have become trapped in tight fascial tissue. And as we get older, everything becomes less movable, becomes more stiff, and facial nerves especially, you'll notice in people who are elderly, they don't have that wide range of facial expression because our skin is connected to our muscles on our face, and that's why we can move the skin on our face. Can't move the skin anywhere else. So here, for example, you have temporalis, and here's the masseter, here's bone, and here we have this area here would be the skin, and then we have fascia, and we get nerves, and this can become entrapped in this fascia. So here's just another image showing what can happen. You know, this would be, for example, where the nerve would go. And if this is all fascial tissue and you get adhesions, then the nerve can't get the signal to the muscle, and this can cause pain or lack of movement. So the facial cups that I like, AcuLift has a set with 2 cups and 2 gua sha tools. There's a 35 millimeter cup and a 25 millimeter cup, and they're real easy to squeeze, which is great because typically those glass suction cups are really hard to squeeze, but even me with my old arthritis hands, I can still squeeze them. And they're glass, and they're hand-blown glass, so they glide very smoothly on the face, which is really nice. And what do I have? So I made this as a little clip, a short clip from
Cups. There's
demo that I did. I was teaching a class, 40 students in Australia, and I did a little cupping and gua sha demo of the face, and I just cut out the part where I was doing the cupping on the jaw.
0.25 millimeter, 0.35 millimeter, and when I'm trying to decide which one to use, it's 6 of one, half a dozen of the other, just whatever fits well. So you take the cup, you hold it in your hand like this. You don't hold it in your hand like this because you will end up with very sore hands. So you hold it in your hand like this and you squeeze. So you approach the person with it squeezed, you suction a little bit. When you're working on the neck, the only thing you can do is suction and release. You never want to drag the cup down the neck or up the neck. When you want to release the cup, when the cup is like this and you want to release it, you have to squeeze it again. Don't go like this and then go, because you're pulling on their skin. You don't want to pull on their skin. So 1, 2, 3, back to Sanjo 17, down the neck, under the clavicle. Next thing you're going to do is start right at Ren 24, and you're going to work right up along the jawline. 3 strokes, 1, 2, 3.
Okay. So, and a lot of these little clips are on my social media. I have a Facebook group called Facial Acupuncture. There's like 9,000 acupuncturists in it. It's only open to acupuncturists and kind of allied health professionals. So you might want to check that out. So for TMJ, you're going to suction the cup at gallbladder 2, at Sanjiao 21, at stomach 7. So all these points right on the side in front of the tragus. And then you can also go behind Sanjiao 17 and work right at stomach 6 and stomach 5. All of these points using massage cupping, gliding cupping. When you're cupping the face, you don't just leave the cup there. And then so it kind of looks like this. You work up the side of the face, come around to Sanjiao 17. And as I said, you never drag the cup up or down the neck. You have to suction and release. And then you can work into the lymphatic area as well. You can also work the midpoint of the face, the mid part of the face, so stomach 5, stomach 6, stomach 7. You can even go up to stomach 8. And all of these help to release tension in the jaw. With gua sha, so the cupping set comes with 2 jade gua sha tools. These are not green glass. They're actually made out of jade. And you can work along the jawline and take the corner of the gua sha tool. You can massage all around stomach 5, stomach 6, Sanjiao 17, and then take the sides of the gua sha tools and you massage back along the temporalis and down the trapezius, and this will release the jaw, the side of the head, and the back of the neck. Everyone is holding so much tension in the back of their neck now from looking down at their phone, And this is just a picture of the cups that I have here from the old set, the new cups. We got a little modern flair with our colors. So that's what the new set looks like, and L.A has these available. So in addition to doing local treatment, so that would be treating the face, the Sanjiao, small intestine, gallbladder, stomach channels. So doing some local points to help to relax the masseter. There are also distal points that you would use, like large intestine 4, which is a command point for the face, Sanjiao 5, gallbladder 41, which are the master couple point of the yang wei mai, and this helps to move qi all around this area. If they have a lot of constrained emotions, they might have some stagnant liver qi, which is causing them to grind. Definitely liver 3, liver 4, the 4 gates, which is wonderful for everyone. So the way I might set up a treatment, I might do a couple of ear points like Shenmen, and then there are points on the ear for TMJ and lower jaw, and do the scalp points. So if they're having pain, you can do sensory. If they're having motor issues where they can't open or close their mouth, you can do motor, and you can do both. And definitely cupping and gua sha. And if you were doing submuscular needling, it would be the masseter, the temporalis, and the auricular muscles, and the motor points for the masseter and the temporalis. This is a list of my upcoming classes. I'm going to be in San Francisco. These are all cosmetic acupuncture classes, but I'll be in San Francisco next weekend, and then I'll be in Rutherford, New Jersey by the Meadowlands beginning of June, then Detroit. I just added a couple of classes in Canada, not wanting to be where I live this summer, which is in Florida. So I will be in Vancouver and Toronto over the summer. Then in the beginning of September, I'll be in New York City. I'll be teaching at Pacific College. And in September, I will be in Dublin. And then looking ahead to 2026, right now all I have is scheduled is a class in Switzerland. I had mentioned that I have a lot of recorded classes. These are all my recorded webinars. You can find them at facialacupunctureclasses.com. L.A.C does have a couple of smattering of these. And then I also offer an advanced certificate course, which is all 15 modules, and it's self-paced. You do a recorded module, you get your CEUs, and you can take as long as you want to finish it. And once a month, I do a 1 hour Sunday live class, and those are the monthly live mentor sessions. And included in the advanced certificate course, you get a live weekend, which is a hands-on class. So any of these, wherever I was, any of these classes would be included. And so I put a QR code up for my classes, and I think L.A.C has a special code for you for the cups and the gua sha tools and anything else you might need. So I think that is the end. I've got about a little over 15 minutes for some Q&A. If there's any questions.
Thank you, Michelle. We only have about 4 or 5 questions, so I will get right to it here. Regarding scalp acupuncture, needle the same side of affected area, opposite side, or bilateral?
Okay, so it depends on whether you're doing motor or sensory. So if you're doing sensory, you do the same side. And if you're doing motor, you do the opposite side. But if you're not getting the results that you want, then you do both sides. Typically, when we're doing scalp acupuncture, we do both sides, but the part of the scalp that corresponds to the face tends to be a little more tender than a lot of the other scalp points. So I tell my students, just do one side and see. So when you're doing scalp acupuncture, you're going to stimulate the needle and you try to get the patient to move the part, and that helps as well.
Okay. Next question is, are you going to do cupping gua sha immediately after needling?
Yes. So there's a few reasons why you would do the cupping and gua sha at the end of treatment when you're working on the face. Normally, we do our cupping and our gua sha, and then we put the needles in and we leave the room. But in this case, we put the needles in, take them out, and then when you're working on the face, you have to use special facial cupping oil. You don't want to be using the same oil that you would use on the back. It might clog up the pores on the face, cause a person to break out. And the reason why we do it at the end, the first reason that I find is it's very relaxing. So you've just been needling someone's face, putting needles in their scalp. Doing the cupping and the gua sha is very calming. So it helps to calm their spirit instead of doing the cupping and gua sha first and then putting the needles in, and you take them out and you're like, okay, you're done. So this, it really relaxes the patient. So they'll come for the needles, but they stay for the cupping and gua sha. And they will let you know if you forget, especially with cosmetic acupuncture. My patients always let me know you forgot to do the thing. So that's one reason. Another reason is it helps to move any inflammation. As you know, the face is very susceptible to bruising and bleeding and inflammation when, little areas where they might get some inflammation. And especially with the cupping, it really helps to move everything into their lymphatic system and out, so they're less likely to bruise. And so that's why we do it at the end.
Okay.
Oh, wait, one more. And you wouldn't want to do cupping on the face and bring all that blood up to the surface and then put needles in, because when you take those needles out, it could be a hot mess. So you want to do the cupping and gua sha at the end.
Okay. All makes sense. How do you clean your glass cups?
Very popular question. So you never want to take the cup apart, because what you can't see inside, the place where the cup attaches, the rubber part attaches to the glass part, it's like a wall anchor. So once you take it apart, you can't get it back together. If you do manage to somehow, a lot of times it'll just break. So I use, in between patients, I use either peroxide wipes, barbicide wipes, any sort of sanitizing wipe on the inside. Then at the end of the day, AcuLift has sanitizing tablets, which L.A has. And I take my cups and I have a big basin of hot water, and you throw a couple of sanitizing tablets in, and it's basically just some salts and other things. It's like effervescent, and it can help to get anything that might have get in. And then you shake them out afterwards, and I use a baby bottle dryer to put them upside down at night, and then the next day I just make sure they're nice and dry. But for the most part, the only part of the cup that's going to be touching your patient is the glass part. So not a whole lot is getting up into the rubber part. Oh, and the gua sha tools as well. I use wipes in between patients. You can even use soap and water. And then I throw these in the sanitizing tablets as well. And just because I'm an acupuncturist, every once in a while I leave them out in the sun to charge them. It's like, I know, very Age of Aquarius of me, but I do it.
I like it.
Get rid of the bad juju.
That's right. And then if you want to just talk about the lubricant you use for gua sha and cupping.
Yeah. Again, AcuLift has a cupping oil. I think, I don't know what L.A has as far as facial cupping oil. They don't carry AcuLift brand serums and oils, and it's just a pricing thing. It's too much to get into.
It comes in your
I have stuff made, so it's on the AcuLift website. I have products made by someone who gets them from someone, and by the time I would get them to L.A to sell to you guys, the price would be astronomical. So you can get oils for me, but essentially it's got arnica and CBD, and it's allergen free. Everything is vegan and organic, and I've never had a patient have any kind of sensitivity or allergy to it.
And Michelle, those serums come with your whole pen system.
Yes. Well, not the oil.
Oh, gotcha. Some of the serums.
But the serums do.
Okay.
Come with the, yes.
Great.
Sorry.
Let's see. There was a slide with the pterygoids listed. Do you needle those as well?
I do. It's something that I usually will like throw into one of my live classes. I don't normally teach it as an online lecture because it can be a little tricky and you can damage the facial nerve if you don't know what you're doing. But essentially you open the mouth and you're going to needle. So you're going to open the mouth to open up like where small intestine 19 is, but you're going to needle from gallbladder 2 straight back. And that does the medial pterygoid.
Next question is, how do you work around a TMJ patient that is a chronic gum chewer who won't quit chewing gum?
I send them to one of my colleagues that I don't like. Oh, you wanted a real answer to that question. When it comes to my patients and compliance, honestly, I try as much as I can to give them facts and logic and help me help you. But I went to an herbalist one time and she told me all of my physical problems would go away, my sleep, my digestive issues, whatever, if I just gave up my nightly glass of red wine. I never went back to her again. No. So I'm just saying. So sometimes you work around your patients as much as you can, but if your patient is going to continue to chew gum, they might feel better for a little while after treatment, but it's like my cosmetic patients that are laying out in the sun or, not using good skincare products, and they or smoke, and they have lip lines, and they want me to take care of it. I say, as long as you continue to do that, you're going to continue to have that problem, and it's on them. And I have absolutely fired patients and had them move on when I never work harder than my patients. So they need to give a little.
That's a good way of saying that. Do you do intraoral acupuncture? You pretty much kind of talked about this a little, but I didn't know if you, okay.
No, I do not. There's really no reason to. And it's just not, you run the risk of infection and all kinds of issues, and you can do everything that you need to do from the outside.
And then this is about the last one, but I'm going to combine two. A couple of people are asking about how deep you needle, and they say, do you typically needle that deeply when doing cosmetic acupuncture?
Okay, so when you say how deep I needle, we talked about a few different techniques. So for motor points, you just needle into the muscle. For submuscular needling, you're getting underneath the muscle. So depending on which muscle we're talking about determines how deep. Cosmetic acupuncture is entirely different. We're dealing with, depending on what we're dealing with, we may just be treating the skin, right? Putting tiny little needles into wrinkles, or just needling different acupuncture points on the face. Or in the example of like forehead wrinkles, we might do some submuscular needling to release that frontalis and just relax that muscle, because when your muscles are tight, you're going to have those wrinkles, which is why people get Botox, so they can't move the muscle becomes relaxed and the skin lays flat. So it depends. The answer to your question is it depends. When I'm doing cosmetic acupuncture, typically I'm treating the skin and But there are instances where I'm treating, so the skin and acupuncture point, so however deeply you would needle stomach 4, but sometimes I'm needling more deeply to really strongly affect the muscle.
Okay, we got 2 more that just came in. I think we have time for them. So how long do needles stay in?
Well, it depends on which technique. So for scalp acupuncture, and so I put the scalp acupuncture points in first. They typically stay in for 30 minutes. So I like to have my patients sit up while I put those in. It's just easier all around. Then I have them lay down, and I will put in the submuscular needling points, any motor points last, and they'll stay in for 15 to 30 minutes, depending. My treatments last about 45 to 50 minutes. So, depending on how much time I have, then I come back in, pull those out, do a quick cupping and gua sha, and off they go. So a treatment is going to last about, your typical hour, 45 minutes to an hour, with the needles being in from 15 to 30 minutes, depending.
Okay, one more because I want to be respectful of time. Is needling for the masseter from origin to insertion or cross fiber to the muscle?
So it's origin to insertion, meaning that's where you start as a rule of thumb. But what's more important with the masseter is you have the patient bite down, you isolate the muscle, and you're really going to get underneath it. So like this, I hope you guys can see me, and like this, to really try to get underneath that muscle.
Great. Well, thank you so much, Michelle, and thank you all for joining us today. If we happen to miss any questions, feel free to reach out to us at marketing@LaSaOMS.com and be on the lookout for an email with a promo code, which is MGWebinar425 for reference, and a link to view the slides. Also, we proudly offer Michelle's products and her book through our site, LaSaOMS.com. There it is. And thank you again for joining us. We so look forward to seeing you all at our next webinar. Thank you so much, Michelle.
Thank you, Robin. And thank you to everyone. Hope to see you soon.
Definitely.